Welcome everyone to the February 10th NEMSIS V3 implementation call. This meeting is being recorded, so if you miss a meeting or if there's a section that you want to share with one of your team members, they are saved and uploaded to our website and also to our NEMSIS channel on YouTube, and you're welcome to review those in those locations. We'll go ahead and start today with a maintenance update. Laurel's going to talk to us for a few minutes about that.
Everyone, good morning. Today, for our maintenance update, we are really happy to announce that we are going to be deploying changes needed to support version 3.5 next week. So as a consequence, our maintenance window will be extended from about midday on Monday until the end of the week on Friday. As a consequence of this update, we will have some downtime next week with our submission service, as well as the cubes and our dashboards may be out of date or not quite as up to date as you would expect to see. Currently, we expect that the submissions web service will be offline between 1:30 on Monday, 1:30 p.m. Mountain Time on Monday, through about the end of the business day on Wednesday, so 5 p.m. Mountain Time. After that, there may be additional processing delays for submitted records on Thursday and Friday, but we expect to have everything back up and running again as usual by the end of the week and certainly by the following Monday. The cube is not expected to update this weekend or the following weekend. So if you're using the cube to access NEMSIS data, you may want to wait a couple of weeks or check in with a member of our team to see how they might be able to assist you with your specific request. And that's all I have. Are there any questions?
Laurel, this is Clay. Could you talk to the vendors a little bit about what message they web services may send them if a record is to be submitted while the web service is offline?
Yeah, so if you attempt to submit any records to us while we're offline, you might receive an error code indicating that it's unavailable, or you might receive no response at all. It's expected that for some of that time, the web service will just be entirely unavailable. So you could see something like a 404 error, or it could just not respond to you. But it would be very clear that you didn't succeed. It's going to be from Monday at 1:30 p.m. Mountain Time until Wednesday at about 5 p.m. Mountain Time. We're going to send out a series of emails announcing that downtime. There will be one that goes out early in the day on Friday. An additional email will go out Monday morning, even though it is a holiday. And then there will be an email that goes out to the Google group Wednesday afternoon or evening when the web service is brought back online.
Yeah, Laurel, so maybe if you'd put those date times just in the chat, if you would, just for folks, and so we can make sure that it's documented, that'll be helpful. Yeah, and then as you mentioned, Laurel, we'll send out to the Google group a message once everything is back up and running.
Any other questions for Laurel? Okay, we'll go to John and Neil with ET3 with an update for us.
Hey, Julianne, can you hear me?
Yep, you sound great, John.
All right, great. If you don't mind, I'm going to just share my screen if I could, and just have a couple of things to point out.
Yes, let's get you co-hosted so you can have that option. All right, that should work for you.
All right. Okay, can you see my screen?
Yep, looks good.
Great. Okay, great. Okay, just a few updates. Won't take long. So we're we're definitely progressing on the onboarding onto ET3. Currently, we have roughly about 24 users that have been approved for security keys. That was as of yesterday. And I have approved roughly 40 plus participant / vendors who have come on board to request an APIR key requester role. So with that, we certainly have a little ways to go, you know, with the numbers of participants we have, which is around 197. And we do have one participant vendor who has successfully been sending in PCR records on a daily basis. They started in mid-January, and cumulative numbers that we've got is right around 5,743 PCRs received. So that's good good news. We certainly want more PCRs submitted. We do have, as a reminder, the February 28th date that we're looking to get the initial ET3 data that's been captured in January of 2021. And ideally, if you can also submit your historical data at that point as well. And just as a reminder, historical data is really data, PCR data that's dated somewhere between March of 2019 to February of 2020. So we're going to be excluding most of 2020 data in terms of giving us that historical data. Just real quick, I just wanted to just as a reminder tip, and I did cover this in our last meeting. Unfortunately, I wasn't able to show the slide, but we've got, you know, a pretty open system that allows for the participants and the vendors, depending on how they want to come in and use the system. They can certainly, as a participant, come in and request a role, which is a model participant role. And that would allow for them to be able to look at the PCR data that has been captured. But the focus for onboarding is obviously the APIR key requester role. And so as a participant, they can come in and request either role. I think the key differentiator I want to point out to folks is if you're going to come in as a participant and go ahead and request the model participant role, you want to make sure that you're looking to request that access for the ET3 model. So there is a choice that you make, and that choice would be the ET3 model. If you're doing the APIR key requester role, then it would be the IC, and we're focusing them to the central data exchange. So there are two different choices there that you need to be concerned about as a participant. As a vendor, for the most part, it's the APIR key requester role. And I think most folks from the vendor ranks have been pretty good in getting onboarded that way. Just wanted to point one other thing out. There is a need for us to make sure that you are inputting the correct field values for particularly the D-agency 1 and 2 values that we're capturing. I just want to point out here in this spreadsheet here I have, this is pretty much just a snapshot, if you will, of a partial list. And the highlighted ones in red, the agency unique state ID and the agency number, those are numbers that I would like to just encourage folks to make sure that they're including in on the PCR.
I think while we're perhaps waiting for him to reconnect, I'll just address the programmatic kind of aspect of ET3 data submissions that I think we've heard from both software vendors on behalf of participants as well as participants directly. It's about concerns regarding the receiving all EPCRs regardless of payer. I think at this stage, it is a big priority for the model team to address. I don't have any concrete answers or documentation to point to right now, because one of the things we've been doing since about last week is just gathering and making sure we have a good idea of all the questions, making sure we address them, and then putting out information in a kind of cover everybody venue. So I don't really have anything to offer at the moment, but just acknowledging we have had those questions and we're working on it. It's a big priority, and we're just making sure that we not only have all the questions and are addressing them, but make sure we have all the responses that fit everybody's needs. So just acknowledging that. And I think John might have joined back in. So John, whenever you're ready, I just reviewed the kind of programmatic questions about the all EPCRs submitted to ET3. So whenever you're ready, I'll turn it back over to you.
Yeah, thanks. Sorry, guys. My cord here must have been disconnected. I think I covered most of it. The only other item I wanted to make sure that you guys were doing, when you send your SOAP message, there is a field called org ID. And in the past, I think in the testing we did in the latter part of 2020, we didn't pay much attention to that. But that is where you want to put the organization name of the participant. And we have various names that we can choose from. The organization name is one of them. There is a doing business as name, and there's also an agency name. But we do encourage that if you can put the participant name in there, all three will work, by the way. However, the participant name is the one that we would prefer to see. So just wanted to stop with that note. And that's pretty much all I have as far as an update.
Julianne, this is Clay. Maybe a quick question to vendors in regards to onboarding. We were trying to brainstorm some ideas that may kind of help the software companies either onboard ET3 participants or help the agencies onboard, depending on the model. And I just wanted to throw out to the vendors who have participants, is there anything that we could offer that could kind of help you with that process?
Yeah, so Clay, this is Andrew with ESO. I think the last time we had a conversation about getting a list that, from John and Neil, so that we could, match that list up with folks that we've asked our customers to reach out to us and say, hey, we're an ET3 participant. We've sent back the documentation. We're ready to go. Here's our participant ID. But we only had a handful of our customers do that, and so there's this gap between the handful of customers that have done that and those that are still needing to be onboarded. So, if I think we had in the last call that conversation about maybe we could get a list of those participants so we could match them up and we could do the reach out to our customers to help get them onboarded.
Yeah, if I could jump in and add, Dr. Mann, I believe we gave you a list and then we tried to coordinate, because ET3 tracks participants primarily by NPI, and then the TAC tracks them by the D agency identifiers. I think we tried to merge those up and match a list. I don't know if, one thing I'll throw out there, I don't know if it's possible to send to the separate vendors through the TAC, the list of participants matched to the specific vendors, for example, a list dedicated to ESO participants. The other thing I will add is the list should be finalized for participants by really beginning of next week. I think the cutoff we've got for the formal legal arrangements that we've checked on internally at CMS, February 15th. So we should have a list there. I think the list we've provided to the TAC already at this point. There won't be any additions to the list. If anything else, there'll be participants removed from the list who have withdrawn, for example. So there shouldn't be any additions. Just a thought that I'll throw out there with what I know is already available to the TAC and what we've provided.
So I understand, the 15th is the cutoff. If they don't get their paperwork back to you by the 15th, then you're going to assume that they're not participating and remove them from the program. Is that what I'm hearing?
That's correct, sir. And it's not so much the paperwork from them. It's we've actually gotten pretty much all the paperwork at this point. It's just to confirm that we've executed and verified everything on our end. But the key takeaway is the 15th. Like after the 15th, and shortly soon after, we should have the finalized list, which of the participants will be in ET3. That's correct.
Okay. All right. Well, I mean, it's, as I said, there's this gap between, you know, the customers who've reached out to us and said we're participants, and, you know, the list you've got, and we're trying to reconcile between the two and figure out, you know, who on the list hasn't told us that they're participating, that we've got to go, you know, rattle their cage and get them set up. So that's sort of where we are. Any help we can get there would be helpful.
Yeah, Andrew, this is Clay. I think that's a great comment. I'll just ask Neil. Yeah, we do have that list, and we have matched the potential list of participants up to software vendors just based on the records that we have received from those agencies. Neil, do you want, we could prepare lists for each of the software vendors this week based on our current list, or do you think there's value in just waiting till next week and verifying the list based on all those who have completed all the process for participation? Which would you rather go out, Neil? We're happy to send either.
Yeah, thank you, Dr. Mann. I think for the sake of time, and given the fact that the list will not be added to, if anything, it'll be subtracted from, it might just be better to send it out and prepare it this time, this week. I think that would be better. And if nothing else, it might prompt some conversations with participants to finally, they might let you know that, no, we've actually withdrawn participation. But like I said, given the fact that the list can only be subtracted from by the 15th and not added to, I think something earlier would probably be better if you can do it this week. So we'd appreciate that, certainly from the ET3 end.
All right, fantastic. We're happy to do that. We'll send that out this week, Andrew.
Appreciate it. Yeah, Dr. Myers and I are for ESO are the ones that were kind of coordinating this with customers. So, we won't be able to follow up with them. That'd be helpful. Thanks.
Yeah, thank you for that, Andrew. And any other vendor, if you have specific folks that you would like that list to go to, if you just list that in the chat, we'll capture that. Otherwise, we of course have contacts with each of the vendors, and we'll just send the list to our contacts.
Hey, Clay, if you could share that with me before you send it out. There are some ones on the list that I think we need to make some updates to, and I do have those updates. So if you could share that, I'll update it, and you can go take it from there.
Oh, okay, great, John. Yeah, we'll get with you today.
Okay, all right, thanks.
Hi, this is Kelly with the Image Trend, and I was curious about if there would be any repercussions for clients that are not comfortable submitting all PCR data by the end of February, or is that something that you guys would kind of allow them to assess and decide if they want to move forward with that, and would they be penalized if they do want a window of time, but why they make that decision?
Yeah, Ms. Clark, I would add that it's still not final. If there's going to be any changes to the data submission requirements from what's currently in both the documentation and as part of the participation agreement, I think if we do make any changes, we'll certainly give notice and allow participants some time to either meet that or decide that they want to leave the model. So I don't think there's any repercussions, and I certainly am not going to be pushing for any sort of repercussions. I think it's only proper to, if there's any changes, give some time to either accommodate the changes or decline participation. The other thing I would add is, regardless of whichever way we go, I think it's beneficial to get participants onboarded as quickly as possible so that they can move in either direction. I don't see there's, until the data is actually submitted to us, you're not really, onboarding is a kind of a separate entity or separate piece of that. So I think it just sets everything up well for whichever way we go with the participation data submission requirement. So that's my 2 cents there. I am not certainly going to be pushing for any repercussions. I think what you also see in the participation agreement, and the participants can point to this, is that if there's any change we give a minimum of 60 days notice for you to either comply with it or figure out whether you're going to continue in the model. So that's in the participation agreement already.
Okay, thank you very much.
We also had a question in the chat about how can agencies can agencies continue to join? One of the vendors has customers who still are interested in joining the model.
Yeah, I guess I'll quickly add on this one. If there are any that are interested, please have them reach out to the ET3 main mailbox. As of this point, we have not either confirmed any additional openings in the model or excluded the possibility. I think if all I can say is that if we do open up the model again, there would certainly be an application process would be restarted. But as of this day, there's nothing definitive as to whether the model is completely closed or if there's going to be another opportunity to join. In the meantime, I think it's great to hear about any agencies that are interested in participating.
Neil, this is Ben at ImageTrend. Maybe just kind of to flush that out a little bit. I mean, I think we had a lot of agencies that were interested. I hear you when you say that it hasn't really been decided, but were it to be reopened, would we anticipate that is, kind of a year after the initial cohort, or not necessarily? I mean, is it possible that this could be, within the next few months, just so we can kind of, keep, because our customers rely on us being kind of the experts on what's going on with ET3, how to help them implement, et cetera.
Yeah, thank you for the question, sir. I wish I could give you a definitive time frame. There's been nothing that I've heard about anything definitive. And I say this kind of tongue in cheek, knowing at the pace that sometimes government works. Sure. I think it's pretty safe to assume it would not open up again anywhere in the near future, just seeing how long it takes to get the approvals for it. So all I can say is if there will be more openings in the model, I wouldn't expect it to occur soon.
Okay. No, that's fine. Thank you.
Neil, would you be willing to put in the chat the email address you would like them to use to forward to agencies that would be interested?
Sure, I will do that. It's the same stock email address, but let me make sure I've copied the right one and don't have any typos, so I'll do that shortly.
Okay, thank you. Are there any other questions for Neil and John while we have them? Okay. Next on the list is Clay with materials supporting formal data request.
All right, great. Thank you, everyone. It's a pleasure, of course, to be with you. I'm going to speak just a moment to the state folks on the call. This item is related to the request that came out in January for an extension on sharing data related to COVID surveillance through 2021. So I'll just remind folks of the letters that have been sent to the states. This one went to state EMS directors from Dr. Sim, who is leading up the healthcare resilience work group. This is an overall letter just asking that we continue to allow some geographic identifiers to be shared, specifically related to the ILI dashboard, I think that many of the states rely on. And there's also a accompanying letter that came from NHTSA, the Office of EMS, from Dr. Kramer, where the request was made a little bit more specific. And actually there were two requests, right, that were included in this letter. And we'd like to hear back from states in regards to both of these requests. So one of the requests is basically just to extend our current ILI data sharing agreement through the end of December of this year. And so this is specifically related to the ILI dashboard, where states can go in and look by county and determine the hotspots for ILI, patients with ILI in their counties, and then also adjoining counties to their state. There is a request to extend the elements that are included in that data release that kind of allow for a zip code analysis of some EMS times. And we've prepared a document that I just kind of walks you through, and you can pass off to folks who will be reviewing these requests within your states, walks through the elements that we're being, we're requesting to be released. And so the current just extension on the ILI data sharing agreement, these are the elements that are involved in sharing the surveillance related tools on the national level that you see as a state, and then are made available to HHS and to CDC and others. You can see we release incident county as the most specific geographic measure, and then basically just some measures that allow you to look at the complaint reported to dispatch, the impression, so that we can actually track ILI. We do include one time, and that's basically just to ensure that we're looking for cases that occur within specific timeframes. The document then indicates all the elements that are not to be released, including major categories of NEMSIS, e-device, e-crew, e-exam, e-history. We talk about the exceptions or single elements in several of these categories that are listed above. If this could be made more clear to audiences that just aren't familiar with the sections in NEMSIS, we're happy to do that if that would be helpful. The document then goes through and for the second release, the second request, it indicates what additional elements are being requested. So really there's only a handful. It does request that we're able to provide the data by incident zip code. The reason why the geographic detail is because we'd like to be able to identify hospitals that are experiencing long offload times, for example. And to do that effectively, we're hoping to use destination zip codes. So that's why the increased geographic specificity. And then we ask for 3 additional times that relate to either time to back in service or time for offload once the patient arrives at the hospital until patient care is transferred to the folks in the hospital. And then again, we list all the elements and sections that are not released and indicate, for example, the additional times that are added. We also will be applying a suppression for geographic areas, and so zip code with counts less than 5 will be suppressed. So to give you an idea of what we've developed and is just kind of hanging out there waiting for release is a map like this that would be available to the states and to federally approved entities where you would be able to identify by zip code areas with extended turnaround times or offload times, right? So just like the ILI dashboard, folks in Utah would be able to see what's happening on their border zip codes to help them better plan, not only for hospitals within their state jurisdiction, but for patients that are often transported to hospitals right across state borders. So it would be a visualization that's very similar to the ILI visualization that's available to states and to federal entities now. It would just include the ability also not only to look for the concentration of patients with ILI symptoms, but also look at turnaround time and offload time. So that's the purpose of the extended request. So we have not heard back from a lot of states yet, only a handful. And I know that any questions can be sent to either Hannah, who leads up the Data Managers Council within the NEMSIS, or you could speak with Monet on our site as well. We will request putting out the description of the elements that are being requested for release. We'll pass it on to Hannah and ask if we're able to share that either in Basecamp or through the DMC listserv. So we'll make that available. I'll ask the states if there are any questions or any additional tools that we could provide that could help you with the discussions that you'll hold in your states regarding this extension for data release. Okay, if there's no other questions, we stand ready to help with any questions the states may have, and we'll make sure that we get that document listing the elements out to NEMSIS today, and hopefully that'll be posted this week. Thanks, everyone.
I put those email addresses in the chat for Monet here at the TAC and for Hannah at NEMSIS. So those are in the chat. Next on our agenda is Josh with resources for testing Schematron. You are still on mute, Josh.
Yeah, that might help if I hit that button too. Good morning, everyone. We've put out an additional resource related to Schematron development. This resource is to help those who are creating Schematron files to have a way to test those files and make sure they're really doing what they intended them to do. This is all optional stuff, so there's no new requirements being put out, just some additional resources. So I'm going to just give you a quick overview of what was added to the Schematron resources, and then I anticipate that we'll probably do a training at some point for those who are interested in knowing more. So I'm on the Schematron page of the website. We updated the Schematron guide and the Schematron development kit. In the Schematron guide, I'm down in about the middle of the guide here. There's a little section about testing that has been in this guide already that says basically that when a state or someone develops Schematron rules, for example, state Schematron rules, that they need to test those rules before they submit them to NEMSIS for publication, and that they should use some kind of test process. So the NEMSIS TAC uses a development process for the national Schematron rules by which we test every single national rule. We have a test case that passes all of the rules, and we have a test case for each of the rules that demonstrates a failure against that rule. And that allows us to make sure that the rule is actually triggering the way that we think it should. Just as a reminder, I want to show you those national resources. And if you're in the NEMSIS public repository, there's a sample data folder. If you go into that sample data folder, there's a Schematron folder. And within there are the test cases for both demographic and EMS data sets. I'm going to go into the EMS test cases and into the XML folder. And you'll see here a series, 154 different EMS dataset documents. And each of these documents demonstrates a document that would fail one of the national Schematron rules. And there's also a summary file, a text file that summarizes what the results should be from this. So let me show you that as well.
Hello.
Yes. Did someone have a question? Okay. So this summary file gives all of the test cases and indicates which of the Schematron rules would pass, would be tested in that test case, and what the test result would be. You know, this should generate a warning, for example, or this should generate an error. So that's what we've done with the national Schematron rules to implement that test-driven development process, where we know that we've really tested every single rule that's in there. So what we've done is we've shared that test process here in the Schematron resources now, and that is documented and provided within the Schematron development kit. So we've added some new folders in the Schematron development kit that allows you to build these test suite files to test your Schematron files, and then some utilities that allow you to run the processing of those tests. And so those are documented here. How you would build the test case or test suite files is also documented here in these pages. So you can download the Schematron development kit, and just show you that real quick. When you download that Schematron development kit, you'll have a new folder called tests that has a couple sample files that would illustrate how you would build your test suites. And then it has some utilities in it, just some little Windows batch files that would go ahead and build all of your test cases. Now, this is not the only way that you could do a test-driven development process on Schematron, and this is not being mandated as the way that you must do it. You could take any approach you want, but this is just one resource that we're putting out there that you can utilize. So again, this would be for people who are building Schematron rules and want to make sure that they can test those rules, make sure that they're actually firing the way they should. So I'll pause there and see if there are any questions. I think there was something in the chat. Okay. Any questions for me on this new resource? Okay, if not, back to you, Julianne.
All right, sounds good. I've got the next couple of items. Oh, we do have one question for you, Josh. Is this just for national rules?
No, this is taking the process that we use for the national rules and sharing it with all of you so that you can use it to test your state rules.
Any other questions for Josh? Okay. So the next couple of items on the agenda are update to infectious disease custom elements and some support material for suggested to defined lists. I'm going to show you where to locate those on the website. We'll also send them out through Google Group and the DMC listserv so that you'll have those resources. So they're both located on the NEMSIS 101 page. And if you go from the main nemsis.org, come over to using EMS data, NEMSIS 101. On this page, we've just collected resources and support material links that are helpful to vendors and data managers. So if we come down here to custom data elements, the infectious disease national custom elements are right here. And you can download this as a PDF as well. The change to this is the COVID-19 recommended ICD-10 CM codes. So this section has been updated to reflect the codes that have been implemented for ICD-10 that are specific to COVID-19. So we just want to make everybody aware of this change. And then the next item is under defined lists for suggested to defined list info sheet. And this is just a 3-page document to help communicate the impact of transitioning from suggested lists to defined lists. Front page, actually we'll make it a little bit smaller so you can see the whole page. History, development, implementation, how we got to this point, and then the impact, elements affected, an example of the hierarchy, and then how it impacts vendors, state and territory offices, and the V3.5 transition. So it's just, this is all things we've talked about on our V3 calls and in our different discussions. So this is just support material that you can use to communicate that shift from suggested list to defined lists. We did have a question though, if it would be valuable to any of our stakeholders to translate this support document into some PowerPoint slides. Would you be likely to use or want to use a couple of pre-produced slides that you can drop into a presentation that just talk about defined lists? Would that be of help to any of our stakeholders? Perfect. That's all I need to know. We will add that to the list of things to do. We'll add some pre-made PowerPoint slides so that you can just drag and drop into your presentations. Okay, awesome. Are there any other questions about these tools? All right, sounds good. Monet's got the next item with the 2020 research data set.
Okay, good afternoon or morning, wherever you are in the nation. I just want to say, and all that I can really say is that you guys are all rock stars. I love the term ask and you shall receive. We asked for the 2020 data and you all delivered. So thank you so very much. This year, we're closing the calendar year sooner than we have in the past, and we have the largest count of records that we've ever had before. The beauty of this journey is that collectively, we are proving to the nation the value of EMS data. And many of you are using your NEMSIS data in a variety of different ways. You're using it to receive Department of Transportation funding, publish reports for your legislators, for your providers, and for your community. And one of the benefits of sending the data to the national level is benchmarking. I've heard this phrase often recently. If you've seen one state EMS system, then you've seen one state EMS system. So thank you for answering my calls and my emails. I really do appreciate the relationships that we have established and our ability to get things done, especially during this pandemic. And as a separate note, I just want to say thank you to Jennifer Correa and Robert Hughes for assisting me with verifying agencies for the ET3 participation. And that's all I have. Are there any questions? Okay, I'll turn it back to you, Julianne.
All right, thank you, Monet. Next item on the agenda is with Atim. Follow up from some of our 2020 annual meeting work.
Yes, so we here at the TAC are going to be taking some time, one meeting a month, to discuss some of the actions that the TAC has taken on various topics that we discussed at the 2020 annual meeting. So far, we have discussed and worked through with you many topics, including ET3, the suggested lists, the COVID-19 custom elements, in particular, the elements for the vaccination information. We've discussed vendor compliance. We have begun a further distribution of the monthly NEMSIS report. We've worked with you on bidirectional data exchange and the V3.5 rollout. We plan to continue to discuss these items and suggestions with you, but we also plan to continue to discuss or begin to discuss HIE data flow, the release of geodata, and data submission lag. So those are all topics that we discussed at the annual meeting, and we have reviewed the meeting notes and the videos, and we've identified areas where we can continue to work with you to help us all be successful. So you'll be seeing and hearing more of those in coming meetings once a month. So I'll just take a minute to ask if anyone has any questions on any of the items that have come from the 2020 meetings that we plan to share and discuss with you. All right, well, thank you. And I'll turn the time back over to Julianne.
All right, thank you. Lots of great work since the 2020 annual meeting. And we are talking about the 2021, trying to wrap our arms around what that's going to look like. I do want to show you really quick. We had a question on where the suggested list support material was located. I'll show you again, and then I'll also put the list in there. NEMSIS, main NEMSIS website, using EMS data, NEMSIS 101 that our very own Chris Hoffman created for us, and suggested to defined lists. And then I'm just going to give you this link. Zoom isn't great about letting you click on links in chat, but at least it will show you. Oh, see, now it looks like it's a totally clickable link. Okay, it's up in there now. Next on the agenda is items from the Office of EMS. Eric, are you with us today? I know you've got lots of meetings today.
This is quite the week. So just a reminder to everyone, today and tomorrow is a National EMS Advisory Council meeting. It's available online. There are 2 links that went out at through Gov Delivery and all of our different delivery groups. If you didn't receive one, you want to, please email myself or Julianne, and we'll make sure we get the links to you. There's 2 links. One is for viewing only and listening in the background. And the other one is if you actually intend to speak during the public comment periods, and that's explained in the directions. The only real thing I have is thanks to the vendors who have been working so closely with the folks from ET3, it has made this, and I know I've said this in the past, a very smooth process for multiple federal agencies engaging in the same project. So I really do appreciate that. I've heard great things. I've shared some of the thoughts with some of the individual folks who have really stepped up and spent a lot of time with this. And if you have concerns that you don't want to share online, by all means, please let me know. We realize that there's kind of a catch-22 for some of the vendors in this, and that there's an administrative piece that's going on, and then there's this technology piece that's needed to support the administrative piece. And with everything going on at the local level, and with everything going on in some of the EMS agencies, we're not quite sure they're paying attention to deadlines, and that's why we're going to assist them in reaching out, as discussed earlier, to make sure that you don't get caught in the middle trying to bring on 10 or 12 people in the last day and a half. So no one wants you to be in that position, and we hear that loud and clear. The last thing I want to just ask you is that these are crazy times. Please be safe, take care of yourselves, and take some time with your families. Every day on these calls, we see more line of duty deaths of these calls. Every day on the COVID calls that I participate in, we see the line of duty death number go up. We hear more about behavioral and mental health emergencies. So please make sure you're taking time for yourselves and for your families. I'll be happy to answer any questions anyone has for our office. If not, that's all I have, Julianne.
Thank you, Eric. Any questions for Eric while we have him? Are there any topics or questions, comments that any of you have for our open forum? Okay. Our next meeting is February 24th. We try to always keep these calls on the 2nd and 4th Wednesdays of the month. Same time, same place. Please let us know if there are topics or issues that you would like added to any of these V3 implementation calls, and we're happy to look at adding those to the agenda. Thank you for being with us today. We appreciate your time. We know that you're very busy, but we appreciate you being with us this morning. Have a great day, everyone.